Hi, I'm Jane. I'm one of the women's health physiotherapists at myPhysioSA at both Adelaide and Mount Barker. I'm going to talk to you today about pelvic girdle pain in pregnancy. We know that about between 48 and 90% of pregnant women experience low back pain or pelvic girdle pain. There's a lot of things we can actually do during pregnancy to minimise your discomfort and to help you, have the most enjoyable pregnancy you can, despite that. So what we're going to talk about is the pelvis and the pelvic girdle pain component of that group. So if you're experiencing pelvic girdle pain, you'll tend to feel pain at the front around this pubic symphysis area, at the back, down low around the sacro-iliac joints, and we tend to find that avoiding things that aggravate those joints can be really helpful, and in particularly staying symmetrical during activities of life. So one of the biggest complaints we have is pain when rolling in bed. So in a moment I'm going to demonstrate a way to avoid discomfort and minimise discomfort when you're rolling in bed. Okay, this is a model of a female pelvis. At the front we've got the pubic symphysis, which sits right down here. The sides are those pelvic bones, and at the back is the sacrum and the sacro-iliac joints. Now we tend to find if we can keep the weight symmetrical through the pelvis, it really aids in keeping you comfortable during your pregnancy. So we've got weight that's coming up through the thigh bones into these sockets here on either side, and what we find is if one of those thigh bones is putting more force than the other, you'll get a bit of a twist or a movement through the pelvis, which ends up being a bit uncomfortable. So I'm just going to show you how to roll in bed, and so that you can do it as symmetrical as possible. Okay, so the first thing to do is shuffle yourself back. So use those strong arms of yours, get yourself onto the bed, and now keep the legs together, leaning down, keep the legs together to bring them onto the bed, laying down on the side, and as we roll over, try not to push through just one leg. So turn your body a little way, keep the legs together, and then you'll need to do a little shuffle but put equal weight through the feet. So shuffle across, and again shuffle across, even weight through the feet, shuffle across, and that should be a lot more comfortable. Coming up again, bending one knee at a time, but again pushing through the feet equally. So shuffling together, move them together, shuffling, and then rolling over. As you come up, use your arms, drop the legs over the side, bring yourself back using your arms, sliding off the bed, and equal weight through the feet. Thank you for watching, and hopefully you'll be able to put it into practice and see how you go. If you need any more help or advice, please contact us at myPhysioSA. We'll be more than happy to help you manage the pain. Thank you.